Dr. Marvin Berman, a very, very warm welcome back to the channel. I'm absolutely thrilled to be talking to you again. You are let me get this right, neuropsychophysiologist. That's
Yep.
a long word, I know. And you deal with brain health and wellness, don't you? Like you're an expert in that field, and you also give expert consultation on photobiomodulation and
And
neurofeedback integration. So
right. And
yeah,
how it all fits together.
yeah, so how it all fits together. So I would love to have a chat to you today. If you actually want to, for people that are new to the channel, just introduce yourself again and what you do, and then
Sure.
yeah, and then we can go from there. Thank you for your
So,
time.
oh, you're very welcome. It's great to be with the people that you reach out to because what we're trying to do is really reach out to as many people as we can to let them know, especially those people who are struggling with neurodegenerative conditions. I think it's really important that we give them an opportunity to understand that there really is an alternative to seeing neurodegeneration or cognitive decline as kind of an inevitability or that there's nothing that can be done. And
Yeah.
I think it's really essential that people understand that there really are non-invasive, non-drug ways of addressing cognitive decline and neurodegeneration and other kinds of, systemic disorders. So I got involved from the beginning with my mother and my grandmother. This is kind of the story that everybody ends up telling. Somebody in their family, something happened, and right. Well, I came at it from being a research oriented psychologist and with a body mind orientation. So I was very interested in the whole idea of psychophysiology and how brain and mind and body work together. That led me to look at the literature in neurology about what happens to people and their brain when they start to lose their memory or they have behavioral changes or they lose their gait, for Parkinson's. So I started looking and found that neurology had been doing many, many years of research on brain electrical activity changes as people progress in, let's take dementia. So there's 40, 50 years of literature about what happens to people as they progress in the process. And they showed that the slower brain waves, the amount of slower brain waves goes up, and the amount of faster brain waves goes down as people become more and more involved with dementia. I was like, oh, okay. And I had been studying neurofeedback and EEG biofeedback at the time. So this was like, oh, well, then what did the neurologist do with that information in terms of treatment? Nothing. Why? Because they don't do biofeedback, they do surgery and give out medication. I went, oh, wait, the people who do biofeedback have been doing research and doing clinical work treating people with epilepsy, which would be interesting and important for the neurologist to know, except they were publishing all of their research in the Journal of Neurofeedback. So, how many neurologists are reading that journal? So I went, oh, there's a there's a gap. So the people at the Quiet Mind Foundation that I started back in 2000, we were doing biofeedback research, and I went, oh, well, why don't we use neurology's own data about the slow and the fast waves and do the same thing that the biofeedback people were doing with epilepsy, which was increasing a certain brain frequency pattern, and they were seeing seizures just decrease to zero
Wow.
with no drugs. And I went, well, okay, let's do that. So we then got people with early to mid stage dementia, got them to start doing the brainwave biofeedback where they were learning to decrease the slow and increase the middle range faster waves. We had half of the people coming into the clinic where we were working with them, but then the other half of the group, we actually took the equipment and put it in their living room. And we taught their caregiver how to do it with them so that people couldn't say, oh, it was Dr. Berman and going to the clinic. And no, we compared the two groups. There was no difference between the two groups in terms of what happened. And what happened was that the people who actually learned to decrease the slow wave activity and increase the middle range faster activity, they got better on all the memory scores of all the neuropsych testing. And we went, oh, well, there you go.
And how were they learning to increase the?
Good, good. So it was a really simple protocol because these are people who were having trouble remembering things. So the idea of giving them instructions to follow made no sense.
Mm.
So what we did is we had them choose a video that they would like to watch, a movie or a TV show, whatever they wanted to watch on the screen. And while they were watching it, they were hooked up to the EEG. So their brain waves were being monitored while they're watching the show. However, we set up a protocol that would monitor the pattern of EEG activity in those slow and faster ranges. And whenever they exceeded a certain level in the slow activity, we would then cut the volume and the brightness of what they were looking at instantly by 75%. But then as soon as they started doing what we wanted them to do with the brain activity, the full brightness and volume would come back over and over and over and over. And they came in over the course of 2 months. They did this 3 to 5 times a week.
So the stimulation was forcing their brain to increase the brainwave activity again.
So their brain was going, oh, I want to watch the movie.
Oh,
Wait a minute. Why did the movie go away? Oh, and then they would focus back on the movie and the brightness would come back. So over and over and over again, their brain was getting conditioned to perform at a different level and produce a different pattern of electrical activity. And that's basically what reward conditioning is, right? When we train ourselves to do anything, right?
yeah.
Or we train a dog, right, to do something, we're rewarding them whenever they do the thing we want them to do.
Pavlov's dog. How
This
interesting.
is this is not Pavlov, it's the other guy, Skinner.
Skinner. Oh, right. Okay. Yeah, yeah, yeah.
It's the pigeon in the box with the food pellet.
Right. How interesting, though.
So except we're the pigeon
Yeah.
and the TV and the video is the food pellet.
How interesting. So when the
So
brain,
that's what
yeah,
neurofeedback is.
how interesting. So when the brain's generating those faster brain waves again, you reward it. And how
Yep.
fascinating. Really
And
fascinating.
when it decreases the slow waves, you reward it again.
Yeah.
So if you practice, right, then you develop a new habit. And the new habit is a more normal pattern of brain electrical activity. So
How
that's what neurofeedback was.
yeah.
While we were doing that research,
Mm.
one of the husbands of one of the people that we were working with sent me an email. The subject line was, "What the hell is this?" I opened it up and it's an article from the Daily Mail. And I went, oh no, this guy is off the deep end. Why is he reading the Daily Mail and sending me articles? What's going on here? You know, he must be nuts. I then looked at the article and went, oh, this is an article about a paper published in the British Journal of Neuroscience. Oh, okay, fine. Then I go read the real journal article. I read the references And I'm going, huh. And the article in the Mail said UK researchers reverse dementia with infrared light. When you first read something like that, it's like, sure. And the Martians took my sister, right? But then I realized when I read the paper, oh, wait a minute, these guys are not kidding. And this was Durham University Department of Pharmacology. I mean, these were serious scientists. Okay, so I called the guy who sent me the article and I said, I can't really punch a hole in what they're saying. It's pretty weird, but I don't think they're kidding and they really are getting results. Do you want me to go to England and get one of their gizmos and bring it back for your wife? So this guy said, well, see if they'll come here. And he had a lot of zeros after his name. You know what I mean? Oh, okay. Hello. Right. So I'm calling these people from nowhere. Hello. You don't know me from a hole in the wall, but what would it take to bring your gizmo to Villanova, Pennsylvania for this guy's wife? 6 weeks later, we're in Villanova, Pennsylvania, and we're putting the helmet on her. We had already done the testing with her for memory.
Yeah.
She had a primary progressive aphasia, which is where you lose your words. She had been doing pretty well with getting her words back with neurofeedback, but she was really still compromised. So we set up this protocol to do it twice a day for 6 minutes, twice a day,
Twice a day.
morning and afternoon. My research assistant goes over in the morning and I was going over in the afternoon. In the morning, about 2.5 weeks into the process, the assistant comes back, tears. What's the matter? Oh my God, they got into such a fight and she was yelling and they were yelling. And I was like, what? What happened? Oh, she was yelling at him that where does he get off making plans to go see their son in Oregon without consulting him? I'm like, wait a minute. Did all those words come out of her mouth at once? Oh no, they were yelling back and forth. It was terrible. It was like in the middle of this, the phone rings. Hello? Oh my God, it's the husband. Oh my God, I can't believe it. She was so pissed. I got my wife back. Click.
Really brings tears to my eyes because it's just so funny about a couple that obviously love each other so much, and he's obviously gone to the ends of the earth to help her, and the first interaction they have is a fight.
Huge, huge argument. And I'm left looking at the phone, right? What just happened?
It's the
Right?
best story.
This
Yeah.
woman couldn't complete a sentence. And now I'm being told that they're having a 5-minute, 10-minute argument. And I'm like, and then it clicked, right? That the light stimulation had increased the level of available energy in her brain so that the neurofeedback training actually could take hold.
Yeah.
And so it really was the combination. It was like, oh, right. It's not one or the other, it's both. And that set the path for the next, I mean, that was 2008.
Is it a little bit like, in simple terms, if you're studying for an exam and you're trying to memorize a journal article, but then you bring a cup of coffee in, and maybe the caffeine and the reading together. So the reading alone might get you so far. The coffee on its own, well, I don't know, but you put them
Yeah,
together.
maybe.
So
Right.
it's a kick up the backside maybe a little bit, or
It's
learning on steroids.
increasing, and it's increasing the production of specific patterns of brain electrical activity.
Yeah.
But what the caffeine can do, it can only do short term.
Yeah.
Just like sugar can boost your energy, but then you crash. So what this was telling me and has been borne out many times now with lots of different people is that all neurodegenerative disorders boil down to two things: lack of blood flow and inflammation.
Oh, right. So, okay, so because this is a really big thing. Like I noticed that in our media here in Australia, they're talking about dementia and Alzheimer's as the biggest health risk that this country is going to be facing. And I think it's going to be the leading cause of death. Because we
Yeah.
have an aging population here in Australia, as a lot of different parts of the world. So you're saying that, you know how you said the slow brainwave activity? So yes, are you saying that it's the inflammation and lack of blood flow that then
Mhm.
causes the brainwave activity to slow?
Right.
Okay.
And
So it
so,
starts with the physiological.
oh, absolutely.
Yeah.
And maybe, the genetic end of it is a- apparently less significant than we thought,
Yeah.
but it's still there with certain people, like the APOE4 genetic marker. But even in those cases, there are people who have significantly altered the slope of decline, even with APOE4. So it's clear that there's plenty that you can do
Yeah.
about that, and that photobiomodulation as a single intervention has been shown, and I have a couple of slides that I can show, has been shown to be effective in improving or remediating a large number of the deficits that seem to lead to the onset of dementia. So if you needed to do one thing could be using light therapy.
So what sort of
So,
when you said it can mitigate a lot of these things, what like so what improved blood flow? So what's the light
oh
actually
yeah,
doing inside?
oh
Yeah.
absolutely. In fact, pop I can pop a slide up. So Dale Bredesen
Yeah.
is a professor of pharmacology, and he wrote a book called The End of Alzheimer's quite a while ago.
Yeah.
And when he did, he was talking about all of the different lifestyle and pharmacological factors that can interfere with people being able to remember.
Hmm.
And dementia simply means memory loss.
Yeah.
He came up with 36 items that he saw as being significant.
Hmm.
And he then developed a program, a therapeutic program for people to mitigate each of those different areas. And he would evaluate each person individually to see how they were functioning on each of those 36 different things. He would then prescribe whatever it is that was necessary to help improve all of them. So he had 10 people that he did this with who all had significant dementia to the point where they could no longer go to work. They couldn't work, they couldn't drive.
Yeah.
Within less than a year, I think it was 9 months of doing this program, 9 out of the 10 people were back at work
Wow.
and functioning fine.
That's
So
fair.
it's fascinating and very well documented.
Mm.
They're now doing another broader, bigger study on that at the right now. They're doing another study, and it's a multi-center qualitative study and quantitative study on their protocols. Now, what the slide is showing on the right hand side, right on the left hand side are all the factors, all
Yeah.
the different factors.
Yeah.
On the right hand side are the peer reviewed publications showing how photobiomodulation positively influences all but one of them.
Oh, I can see that. Oh,
And
how
our
Fascinating.
papers and other people's, these are all our publications and all the other people's publications.
Oh, that's
However,
fascinating.
there's all of these along with it. So if you see what I mean, there's these, and then there's this many more. And all of these are addressable using photobiomodulation in some form.
How fascinating. Because I know that they talk about trying to prevent or delay neurodegeneration or delay Alzheimer's or Parkinson's, even with lifestyle factors like exercise. I mean, that would be then increasing blood flow to your brain, good
Exactly.
diet, socializing, all of that sort of thing. So,
Yep.
if so, I guess the red light therapy is then that is increasing your blood flow. So I guess if you're addressing it as best you can with lifestyle as well, then how can the red light therapy
Right.
come in and it probably what boost your efforts?
Right. So if we go back to kind of early or high school uh, understanding about biology,
Yeah,
right? And we know about the mitochondria,
yeah,
right? We know that the food that we eat turns into sugar, and that gets absorbed by the mitochondria and increases the production of ATP,
yeah,
adenosine triphosphate. Well, it turns out that one of the proteins in the mitochondria is called cytochrome C oxidase. It's the last protein in the chain.
mhm.
That protein is a chromophore, which means it can accept photons of light. It absorbs light energy.
So just one protein in that chain.
And it's the end protein that
Yeah,
absorbs it. Now, what that means is that within the band of 700 to 1100 nanometers, those photons of infrared, near infrared light, when they hit the mitochondria can absorb that packet of light energy and treat it as if it was food.
ah,
So it's another way to literally nourish our cells directly.
that makes so much sense. So that's why it can help with everything from skin health to
Fill in the blank.
brain health.
Yeah.
Wow. So eating, I mean, this sounds like a no-brainer. I mean, or this sounds like a stupid question, but eating more food wouldn't do anything to this like so if you say it can nourish or sort of nourish your mitochondria like food can, you can't replace that with more food. This is a new pathway that comes in, obviously. Yeah.
It's an additional source
Yeah.
of energy.
Yeah.
Now, another kind of way of thinking about it proportionally is that when we were doing the research with the 1070 helmet, remember that big goofy looking thing I showed you? Right, the Darth Vader. Yeah. So we were using a more powerful device for the research,
Yeah.
which I then modified into the Neuradiant and now the Neuromatrix. But what we were delivering in 6 minutes, it would take someone being at the equator at noon for 100 hours in a row
Ah.
to get the equivalent amount of near infrared light that you're getting in 6 minutes from the device.
So it's like any other pharmaceutical drug. You're taking something from nature, but
Right.
um, just magnet or just bringing it down to just that powerful thing that you need and delivering
Yeah.
it in a powerful way. Yeah. Yeah.
Right. We're selecting and having a more directed influence
Yeah.
on a particular biological system.
Yeah.
With with the light, we are doing something that is completely natural
Yeah.
and fundamental in the most fundamental sense to support life. So that 85% of the reason that there's life on Earth
Mm.
is because of near infrared light.
We did,
So,
yeah, because I've been looking a lot on sleep studies as well, like, trying to get maximum sleep hygiene. And that's what they're saying, that we evolved with the light. We evolved to, wake up with the light, go to bed with the light. And of course, obviously we can't but be in the sun for that long anyway because of the skin cancer risk and all of that. So,
right. So 20 minutes, I mean, it's recommended that if you want to get your sleep improving and renormalizing your sleep, then you want to get about 20 minutes of sunlight on your face, on your hands between dawn and 10:30 in the morning,
yep, yep,
so that the light is hitting your eye at the right angle, and it stimulates the production of melatonin,
yeah,
which you use then at night to get sleep.
yeah, yeah.
And that's the cycle. So us having blue light and other kinds of light at night messes up the cycle. And that's why a lot of people are having trouble.
Yeah, yeah,
So
yeah,
this renormalizes the circadian rhythm,
yeah, yep, yep.
because we only recommend that people do the photobiomodulation during the day when the sun is out. And when it's not, then not at night, because you're supposed to go back in the cave and go to sleep
I get it. I do get it. Yep. So,
for 200,000 years.
yeah, yeah. So the light is so let's talk about then exactly what the red and infrared light is doing to our brain that's unique that we probably couldn't really get from other sources. So it's an additional source of energy. It's boosting
Yeah,
that mitochondrial energy. It
it,
can reduce inflammation.
absolutely,
It can increase blood flow.
because it's also influencing the flexibility of the blood vessel tissue. The tissue
Oh,
inside the blood vessel, it's called endothelial tissue.
yeah,
So as we get older, atherosclerosis, the blood vessels aren't as flexible.
yeah.
If they're not as flexible, you don't get as much blood flow.
So how is it increasing the flexibility of these tiny blood vessels?
The light influences the tensile flexibility of the endothelial tissue itself. It warms it up.
Oh,
And so
interesting.
it gets more flexible
Yeah,
by absorbing the energy, again, absorbing the energy from the light photons and gaining and increasing the flexibility of the tissue inside the blood vessel, so that it means that you can have the expansion, you can increase the expansion of the inside diameter of the microvessels, so the blood can then get further out to the edges of the cortex. And that's what happens as we develop, dementia and
yeah.
other kinds of aging. We're losing brain blood flow to the edges of our cortex. And that's why we're losing neurons.
Is that why the brain is then shrinking?
No blood flow, no growth. No growth, goodbye.
Interesting. So if you have had some brain shrinkage, can you, with these, can
Yes,
you increase it again?
sure. I mean, there's also been evidence shown of, I think, an 11% increase in brain volume from meditation practice.
True. Now, why
So
would that, yeah, why would that be, do you think?
relaxation,
Yeah,
increase, right, broadening your brain's activity,
yeah,
not being so hyper focused on survival, but
yeah.
being more internally focused, more relaxed, allowing for more flexibility to happen, not being not being stuck in a rut of thinking.
How interesting.
So by doing the mindfulness meditation practice,
Mm.
people increase their brain blood volume. We're now seeing that the photobiomodulation in the neuromatrix, the new version of the device that I have now, there's now programming for a meditation protocol.
Ah,
So we can stimulate people who are not meditators.
yeah.
We can take people who've never meditated before and they can sit with the protocol and it will systematically stimulate a slightly faster and faster and higher level of activity in the brain, leading to a state of deeper internal focus and relaxation.
How fascinating. That's
Yeah, yeah.
really fascinating. So if you're so you work with people that are struggling with neurodegenerative conditions.
Oh,
So
yeah.
if you did have, say, a diagnosis of a condition, how can red and infrared light therapy then help this person?
Well, from from the beginning, I have been doing an evaluation and an intake and a kind of systematic evaluation that's more comprehensive about their lifestyle and what's happening, what their history is, other challenges. And I'm especially interested in early childhood trauma. And there's a questionnaire that we include called the ACE questionnaire, which is 10 questions. And I found consistently that people with higher ACE scores are the ones who are developing neurodegenerative and neuropsychiatric and other kinds of health conditions sooner and sooner and with more severity. So there's a direct relationship between that early childhood trauma and people's predispositions to various kinds of health conditions. The mind and body really aren't separate. That's the bottom line. So um, we work with getting people to become aware of those things and start doing things to take care of themselves and deal with their feelings more, but also to then evaluate using quantitative EEG, the brain mapping process. So we do a brain mapping process that's a non-invasive recording of EEG, brain electrical activity, at 19 predetermined locations. We can then compare someone's voltage, the literal voltage coming from the brain, we can measure that and compare it against a normative database that's broken out by age and gender. So if you were to do the brain map, we would then compare your readings against the average of the women who are a year or so above or below you, and we could then see where you are on the different areas of your brain and whether they're above or below normal in their amount of voltage and also in the patterns of activity, which they call neuroconnectivity, right? How are the connections looking, right? And so there's an awful lot of data there that we can then analyze. And then from that, we can then program the protocols for the photobiomodulation. And what I did with the new version of, well, the original version of Meridian was to divide up the helmet into 4 quadrants, a front, a back, a left, and a right. So here we're able to differentially stimulate those areas so that we can influence them in the right direction independent of each other. So we can have a much more granular, a more specific, a more customized way of delivering the light so that we get more rapid and lasting results. That's the photobiomodulation part of it. The neurofeedback part of it would then be to use the same exact QEEG data to then even more specifically modify the different patterns and networks of activity using that operant conditioning paradigm. So the light therapy increases the brain's capacity to make good use of the subsequent neurofeedback training. So you would do the light before you do the neurofeedback training, kind of like warming up before you then work out in the gym. It's
How,
literally the same. It's literally the same thing, really.
yeah.
It's literally the same.
How interesting. So you're using that real data from someone's brain to
Yep.
to work out where the gaps are, say,
Yep.
and then to actually boost them using the light therapy.
And it's really important to that our perspective is that what we're doing doesn't have to do with specific disease processes. It doesn't have to do with diagnoses,
Yeah.
right? This isn't a medical device, right? This is not a medical treatment. And it's important people understand that, right? It's not FDA approved. It's not FDA, it's not a medical treatment, but it is a way, from our point of view, of enhancing brain health and wellness by increasing the efficiency by which the brain is functioning. That brain efficiency is different than brain pathology.
Yeah.
So we're really focused on enhancing the underlying fundamental efficiency of our central nervous system. And
Yeah. Yeah.
that's how we focus all of what we do.
Yeah. So a bit like sending your brain to the gym.
Quite quite literally, right? It's going to the gym from the neck up.
That's great. And you, with the scientific data that you're getting, can steer the brain as to which of the equipments is going to be best for it, whether it's the
Yep,
bike or the weights.
right. And
It's
like in
great.
the gym, you've
Yeah.
got the card
Yeah.
so that you can see how many reps did you do, right? How much weight did you use? What was the setting of that machine? And
Yeah.
you've got the specific data of how well are you doing. And you also have how are you feeling? So it's literally the same thing because it's measurable, it's specific, right? It's the same thing. We're just measuring something else that's changing in the body, and it's the way your brain is functioning electrically, neurophysiologically, and physiologically.
So the light, how can it influence all three? So the electric impulses, how can it help the electrical impulses work better, I guess you could
If
say?
well, that if you're if um, a Dr. DeRitter published a paper a while ago in Nature, and he was talking about how brain biofeedback
Mm.
was able to modify people's brain electrical activity using that idea of operant conditioning. And
Yeah,
what Dr. DeRitter showed was that people with PTSD and depression all showed significant improvement when they did this particular kind of neurofeedback. And then he said, however, what he saw happening was that after weeks to months after they finished treatment, they started to regress. And what he said was it seemed like they were running out of gas. And I saw that and said, I think I've got the gas station. So he's now using photobiomodulation to influence the sustaining, right? The
yeah,
robustness of the neurofeedback training by increasing the available energetic resources in the brain on a regular basis. And that by doing that, the brain efficiency becomes self-reinforcing
yeah,
because our brain is always looking for the more efficient way to do everything.
yeah.
That's what the cortex job is,
The
right? To
the most
find the most efficient. That's it. Homeostasis. It's always looking, the goal is always to burn the least number of calories in order to perform the task.
right for
It's that
human
it's at that
survival.
very basic level of functional efficiency.
Like metabolic, that makes sense. Yeah,
It's literally that.
yeah,
And
yeah,
so we're always looking for the more efficient way to do that.
yeah.
However, the upper cortex paradigm for learning, according to Moshe Feldenkrais, who's a physicist who developed the Feldenkrais method and who looked at human movement and analyzed it from a physics point of view and understood that we're always looking for the more efficient way to do things. But the upper cortex learns by rote repetition,
Right.
right? Subcortical learning, the lower part of the brain learning, right, does not use rote repetition. It uses parsimony. It uses efficiency.
Ah,
So
right.
when you teach somebody at the lower brain level
Yeah.
how to do something more efficiently, it drops the old way and adopts the new way and locks it in like that.
Ah.
It's not practice makes perfect. It's, oh, that's easier. Thank you very much. I'm going to do that from now on.
And is that what the brain, is that how it's adapting to the light therapy?
The light therapy is increasing the brain's capacity to make those kinds of discriminations about what is the more or less efficient way to do fill in the blank,
Ah, right. Okay.
everything.
Yep. Yep.
So we're always trying to find the more efficient way to do whatever it is, moment to moment, right? So I use the term adaptive response capacity, ARC,
Okay.
and that what we're always trying to do is increase our ability to respond adaptively.
Okay.
And
Yeah.
so the light therapy and the neurofeedback are ways of educating ourselves, right? In at different levels of educating and informing ourselves about how we can approach responding more efficiently, period.
It's such an interesting topic. And I think the brain health and wellness is relevant to people of all ages now, I think, isn't it? Like it's
Oh, yeah.
yeah, like people are really looking to, I think, increase their health and wellness across the board, and brain health has become a
Sure.
one of those real topics that probably wasn't talked about like maybe 20 years ago or something, but now it's kind of in it's trending.
No, I've been, yeah,
But it's
I've been
but
talking about it for a long time. You see this kind of flat spot on my forehead?
yeah, but it's become more mainstream, hasn't it? Yeah, a lot of people are very aware of it now.
I
How
can,
important it is.
yeah, I can show you, I can show you another slide about that. So as of September 14th of
Yeah.
this year, these are the numbers of publications listed in the archives of PubMed, the
Yeah,
research
yeah,
database.
yeah.
So these are just search terms that we put into PubMed, and those are the numbers of publications that we're now seeing.
Yeah, wow. That's and I'm interested in the 1070 as well, that nanometer. Why
Yep.
you choose the 1070? Is that the one that's the most it can penetrate the deepest?
It is a way of penetrating deeper,
Yeah.
but there are also some other reasons why we might want to do that. So what Dr. Lee Hanli Liu and Greg Pruitt at the University of Texas in Arlington, they took a laser for 800 nanometer laser and a
Yeah.
1064 laser,
Yeah.
and they shined it on the forearm of a person.
Mm.
And then they used what's called functional near infrared spectroscopy to measure the changes in oxygenation in the blood and also the production of that stuff cytochrome C oxidase which is the output of the mitochondria. So they
Yeah.
were measuring those two very important components.
Mm.
And what they showed was that the 1064, right? You can see in the oxygenated hemoglobin, the
Yeah.
1064 is producing 100% more,
Yeah. Yeah.
right? And in the cytochrome C oxidase, it's also producing 100% more. The pink area of the square of the slide, this pink area is the amount of time that the light was shining on the person, was 10 minutes.
Okay. Yeah.
So
Yeah.
after 10 minutes, there was 100% more cytochrome C oxidase and oxygenated hemoglobin being created by the 1064, 1070
Yeah.
compared to the 800. Another interesting feature is that they were using lasers, but then they used LEDs
Oh, okay. Yeah.
and they compared 800 nanometer laser and 800 nanometer LED light. And that's what this bottom one is.
The
So what we can see is that the laser certainly produced more over time.
mm,
The LED continued to produce more, but then they turned the light off and then the laser started to drop. You see that at
yeah.
the end? The LED continued to increase after they turned the light off.
Oh. So it kept working after even after the light was turned off.
And that goes back to the idea that if you're only hitting a specific area,
Yeah.
you're only stimulating the mitochondria at that spot.
Oh.
But if you're using LEDs, you're stimulating a much larger area and therefore hitting more mitochondria with the photons of light.
Yeah.
So it continues to increase the response because you've hit more area. So the reason why you want to use a helmet instead of a panel
Yeah.
is because you're covering more area and you're directing the photons just the same way you would with a magnifying glass on a leaf with the sun. You're focusing the light down to a point and generating more energy.
Yeah.
So that's what's happening with the helmet. You're generating more light that's getting concentrated down into deeper and deeper regions of the brain.
Yeah. Yeah. How
I like,
fascinating.
yeah, really, I like this. They did some really good work here. It was really very helpful.
So tell me how you're using red and infrared light therapy in your daily life then as a practitioner. So with your patients.
I'm using it with people almost exclusively now, having them get the device and use it at home. And
Yeah.
then we do this kind of remote consultation. I can send people to a local practitioner. There are lots and lots of people in Australia who I work with, and they go to see a practitioner that I know who does the recording of the EEG. They just email me the raw data. I use my software to do the analysis, right? And then we look at the pictures. We can just look at the pictures of what we find. Let me give you another share. This is the quantitative EEG, and
Yeah.
this was from the research that we did in Texas at the Baylor Scott and White Hospital Department of Neurosurgery. And this is the placebo group.
Hmm.
So we did a multi-site randomized placebo-controlled trial where people took the devices home and we measured their brain activity, compared it against norms, like I said, by age and gender. And this is what we saw in the placebo group. And you can see, remember that I talked about the slow waves? These,
Yeah.
it goes from slow to fast. These are the overactive slow waves. And you can see there's considerable amount of slow And remember, the blue meant deficient. So there was a considerable deficiency in the faster brainwaves. Here's the group that did the treatment.
Oh, wow. Oh, you
It's a little,
can,
it's quite a bit different.
how fascinating. So, and yeah, like I don't know, you probably know that my husband's actually a medical doctor and he's always said that blood tests don't lie. Like
Right,
and so the EEG would be very similar, wouldn't it? Because these scientific results, they are just showing you what it is.
right. This is not Marvin Berman's opinion.
Yeah, and it's not the patient's opinion either. It's not the patient
No,
saying, I feel better. This is like
right.
actual
No,
results. Yeah.
right. This is not
Biology.
about that.
Yeah. How
So
fascinating.
it's much more straightforward this way. And
Yeah.
that's why I like it, because it helps, especially with people like young people who have anxiety or depression, or especially athletes, people who've gotten hit, in the head and
Yeah.
hurt. Instead of them judging themselves as being somehow inadequate,
Yeah.
right? I'm lazy, I'm mentally ill. It's wait, no, 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 no. Look, you got hurt. I don't know when. You can tell me when you got hurt, maybe, but we're looking at you having gotten injured and you have yet to recover, period.
Oh, I love that.
You're not lazy, you're not crazy, you're not, it has nothing to do with how you felt about your mother. It's none of that.
I love that. I really, really love that. That would, as
Right.
yeah, especially when you're talking about things like the anxiety, depression, going down the mental health. You're not labeling like you're just looking at the
Yeah.
physiology. I really love that. That's great.
And
It's really
and
looking at it from a medicalized point of view rather than just like you said, labels.
right, right. And it's like this is the reality of what's going on in your brain.
Yeah.
Really no kidding.
Yeah, yeah, yeah. Yeah.
And it's not something to judge, it's something to
Yeah.
understand. And now, how about we make a plan to modify what we're looking at?
How fascinating. So let's take then depression, say.
Sure.
You look at a brain with, is that also going down the more slow brain waves, or what's happening there?
To, to some degree it is, but there's also specific patterns in certain kinds of depression where you can see that there's too much activity in the right hemisphere and not enough in the left, in the front. So
Right.
there's different ways of analyzing brain electrical activity to then work more diagnostically. And there's a great deal of research about something called alpha asymmetry, but this is not the venue for that kind of conversation. But it means that we can understand that if your brain is working less efficiently, it means that you're going to run out of gas quicker.
Yeah.
And if you keep running out of gas quicker,
Mm.
you're going to have that thought, why can't I just get it? And that why can't I just becomes because there's something wrong with me. And that becomes the story and
Yeah.
the narrative that people start telling themselves.
Yeah.
And it becomes self reinforcing.
Mm.
So, this is a way to interrupt that narrative and go, wait a minute, wait a minute. What if it's really that you're actually running out of gas and you can't produce the kind of gas mileage that you need in order to get where you want to go?
Mm.
And what if you had more energy, more gas in the tank? Maybe you would just, get where you want to go. And you wouldn't have that story playing in your head,
So with the
because we're
light
always trying to
therapy, yeah,
well, we're
and
always trying to explain what's going on. We're
yeah,
always trying to explain our experience.
yeah,
Right. But that storytelling isn't necessarily based on real data.
yeah,
It's
yeah.
made up out of all kinds of things.
Yeah, I love it. So with when you're saying about depression, if there's too much brain activity in one hemisphere and not enough in the other, with the light therapy, say, you can try and normalize that out. So increase
Because we can deliver, right, we can deliver light over here to bring down or bring up what's going on. And we can do the same thing over here at the same time.
how interesting. And then what about anxiety? So because often
It it's all the same, it's all the same thing.
so
These
you'd
are
be
all examples of inefficient neural processing.
how
So
interesting.
anxiety, I mean, certainly there are lots of great psychotherapy approaches to managing anxiety.
Mm.
The most important one for me is respiration.
Yeah, the breath. Yeah, you can bring
And
down your nervous system, can't you, very quickly? Yeah.
and so I routinely ask people to count the number of times they breathe in a minute.
Yeah, so is it if you exhale, as long as your exhale is longer than your inhale, is that going down the right path of the,
It's certainly taking you in the right direction, especially if you're only inhaling through your nose.
yeah, yeah, I do remember you said that. Yeah.
Even when you're talking,
You know that, and that's something like that is a real challenge. I've got,
you're still working on it. I
yeah,
could
I'm
see
still
you're
working on it
still working
because
on it.
I've got really dry, the inside of my nostrils are really dry. And so my I get sort of inflammation from like strong smells, perfumes, deodorants. The nasal mucosa feels dry. Yeah, right. Vapor rub. Yeah, vapor rub. Yeah. You
Or
reckon put that on
eucalyptus oil.
eucalyptus. Yeah.
I But the reality is, if you inhale through your mouth,
Mm.
you automatically stimulate adrenaline going into your blood.
No, and that's not good.
If you have anxiety, adrenaline is not your friend,
No, it's not.
not your friend at all.
No, it's not. Adrenaline, cortisol, and being woken up like that. Seems to, when you're having disrupted sleep, which a lot of new parents have to deal with,
Oh boy,
and parents of toddlers. That sets off like when you're sleeping and you're jerked awake. That seems to set off a stress response.
absolutely, absolutely.
Yeah.
So the idea of getting people to monitor their own respiration
Mm,
and see that as they become more anxious, the number of breaths they're taking is increasing. And that the more they can reverse that and slow themselves down,
mm,
then they can start to modify respiration, which means heart rate, which means O2, CO2, and all the other factors that go into what we call sympathetic fight flight arousal, as
yeah.
opposed to parasympathetic cool and calm.
Yeah, yeah. Well, how might light therapy then help with
The
modifying the
light,
stress response?
well, certainly the light therapy is giving people extra resources
Mm,
to feel up to the task of whatever is in front of them and feeling more filled up and equal to the task, but
mm.
also because we can stimulate brain activity that increases the experience of being relaxed and alert at the same time.
That's really interesting that you can do that because they seem like an oxymoron, like the alert ready, like, and relaxed at the same time.
Right. But that's really what happens, is that the what they call the sensory motor rhythm in the
Mm,
brain is somewhere around 12 to 14, 15 hertz, right? Cycles per second. But at that 12 to 14, we're seeing that people can experience feeling of being equally relaxed and alert. So one of the things that we do in some of the initial protocols that I will design with people is to have gas in the tank to begin with, then 40 hertz stimulation, which increases people's alertness and also decreases the beta amyloid in the brain and increases the blood flow, and then use the 14 hertz to then settle the system into that state of relaxed alertness. And people will use that as a kind of beginning entry point into how to use photobiomodulation for forever. Because really, this is a vitamin, it's not an antibiotic.
Yeah.
You're going to use this in some way forever.
Yeah. Yeah.
And why wouldn't you?
Well, it's like going to the gym, isn't it? You can't just go to the gym for 6 months and then that's it for the rest of your life.
No,
But
no.
using a helmet device is a lot easier, I have to say, than pushing weights because you
Oh
can,
yeah. Well,
yeah,
yeah. And I've seen you using, and you can use the helmet anytime, even when you're pushing weights. So what I had designed was something like this.
oh wow,
So you can put it, it's got two probes
yeah,
that'll go in your nose, and you can put that in your pocket, right? And you can do it while you're at the gym, you can do it in the car, you can do it anywhere, but it's delivering 80 milliwatts of infrared, near infrared light, 1070 light right up into your nose. So that can become really handy down the road because you know there it is. You can just deliver the light and feel completely energized. But the thing that I was interested in was being able to study this in relationship to COVID,
mm,
long COVID, because one of the studies that we supported was this one. This study was about using the Neuradiant and comparing it with the Thor laser bed that you can lay down in. So they took people with long COVID
yeah,
who were independently diagnosed for 5 months minimum, and they then divided them into two groups. One got in the bed and the other got the helmet.
mm,
And they got them for 14 minutes, 3 times a week. That was the process, right? And people describe brain fog. Can you still see the
yep, yep, I can see it. I've got Homer Simpson here.
good? So this is what they said. They even said we feel like we've got Homer Simpson brain.
Yeah,
So they did tests for brain response speed. It's called an event-related potential,
mm,
ERP, and they showed that the pre to post was significant in terms of all of the subjects. So the helmet, this is the helmet data, the significance of the change after 1 month, right? After 1 month, all the people, the 14 people that were in the study, all of them remitted their symptoms. They were completely fine. None of them had long COVID anymore,
yeah,
right? These are the results of the tests for everybody. And these are very, very significant results.
mm,
And these are brain response times and the capacity for the brain to function flexibly, right, and responsively. So it showed that brain processing speed could improve, right? And that whole body treatment versus transcranial were equally effective.
yeah. That's really encouraging, isn't it? Because I think to buy a red light therapy bed is there's quite a few zeros behind after. I think it's probably
Yeah,
buy waterfront.
120,000. Yeah, 120,000 versus three or
Yeah.
3,500.
Yeah,
Yeah, it's
yeah, 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 yeah. They are very expensive. So the helmet is just as effective. That I think that is really positive.
I'm very impressed, um, and happy to see that we can achieve those kinds of results, with a very straightforward kind of process like
Mm.
the helmet. Um,
So there's quite a few different devices obviously on the market, and in fact, one device I've got is a Hooga. It's for aesthetics. It's a red and infrared light therapy mask and neck piece. And I was very
yes.
interested because it's got infrared light in it too. So I'm using it on my face, and the neck goes over my chest here, sort of where over my heart, which I'm
Hmm.
happy about because that's infrared light as well. Excuse me. So, would that be penetrating into your brain at all, do you think? Because it's got the infrared very
Very little.
little or not really?
The amount of the amount of irradiance or power, uh, which is measured in milliwatts, it's not really that high. Could
Very
it
low.
could it influence your skin? Absolutely. Could
Yeah.
it influence blood flow? Absolutely. Is it going to penetrate down to deeper layers? Not so much.
Yeah.
And the higher wavelength has more of an impact on things like elastin production
Yeah.
for wrinkles.
Yeah.
Yeah. So a lot of women, I can't have the conversation about dementia and then say, oh, by the way, it's good for it's you can't do that. But in fact, if you put it over your face, you're going to get better skin. I mean, you know, my skin looks pretty,
Do you know,
but I've been doing it for 18 years. So,
perfect. I was going to ask you, do you use a helmet yourself?
oh, for sure.
Yeah.
I've been using it for 18 years
Yeah. Yeah. And what do you use it for? Just as the going to the gym thing.
to,
You're
to
just,
stay sane,
yeah.
in a crazy world,
Yeah.
and also for overall energy
Yeah.
so that I could, sound like a normal person at 10 o'clock at night.
I know. I'm so sorry. I genuinely appreciate your time. But yeah, so
That's
so
great.
what you're saying is even though you haven't been diagnosed with anything, which, thankfully, I, many people that are interested in these devices haven't had any sort of diagnosis. They just want to use it for brain health and wellness.
Right, right. And so
Yeah.
biohacking is a really
Biohacking, yeah.
useful. Yeah,
Exactly. Yeah.
absolutely. I think, tools like this one and tools like the Sarah Thrive. You've met with Sarah, haven't you?
I haven't,
Sarah
but I
Turner?
think I've seen her on LinkedIn. Yeah, I think I know who you're referring to.
Sarah and I worked together to develop the Neuradiant, and then she went on to create Sarah Thrive. Yeah, it's a brilliant device
That's
for gut brain health. Absolutely.
that's
So
beautiful.
the yeah, oh no, it's a really useful device. Um,
So I've got another
let
question for you as well. What if you just purchased a helmet device and let's say it's a good wavelength, it's a deep penetrating wavelength, but you're not
right,
having any sort of clinical guidance and I guess well, oh yeah, cool. So, like say for instance I'm just using a helmet device without
right.
any sort of guidance. I'm just using it for 20 minutes a day. What sort of benefits, in the absence of any sort of EEG or anything? I did, after my seizure, I did have an EEG at Gold Coast University Hospital, but I didn't see the results. But apparently, it was just labelled as normal. So the EEG was just labelled normal. I don't know anything more about that. I think they were specifically looking for epileptic activity.
Right. They're not gonna subject the data from there. They're gonna look for tumors and
Yes,
seizures and things like
yes.
that. We're
Epileptic.
gonna
Yeah.
we do something completely different with the data.
Yeah, yep, yep. So in the absence of anything else, me just using it
Sure.
for 20 minutes a day, what would that be helping me with, do you think? Would it be giving me some benefits even though I don't have
Oh
clinical
no, I mean,
ones?
of course. Again, we're talking about increasing efficiency.
Yeah.
So if you're making your brain function more efficiently,
Mm,
then it's all about working smarter rather than harder.
yeah.
So everything is going to be easier because you have more energy and greater efficiency at addressing whatever it is that's going on.
Mm, yeah.
So it's a systemic intervention.
Yeah.
It's going to, and that's really important because it's not a medical treatment for a specific diagnosis. That's not what this is about.
Yeah.
It's really about making your brain work more efficiently. And to that degree, you can do more, you can achieve more without expending as much energy,
Yeah.
things become easier to accomplish.
Yeah. Yeah.
And
And at
so you
what
feel better.
Yeah. And then at what point would you advise people to seek clinical consultation then?
Hey, if there's an already existing diagnosis, if there's an already existing issue that you've had, then certainly. But one of the other things is if you take the ACE questionnaire
Mm,
and you have one and your score is not zero,
yeah.
then it would be worth your while to investigate doing some work with yourself to help reduce the stress that you've been carrying around your whole life.
That makes
And there
sense,
are ways,
doesn't it?
yeah,
Yeah, the childhood trauma thing. Because um, do you think it's if you do experience some sort of childhood trauma, do you think your brain um shrinks or protects a certain part of it, or I don't know, it's hard to describe. Because shuts off a certain part of it or something to protect yourself? Is that what's happening? Do you think?
certainly your brain develops patterns of response that are limited
Yeah.
by virtue of the chemical reaction that we all have to any kind of trauma. Any kind of trauma causes a contraction.
Yeah. So it's
And
just
so that
interesting that link.
contraction, that contraction at a very early age
Mm,
is going to then influence the rest of your development because there's this chronic level of inflexibility that comes from the response to the traumatic event. And if that response isn't resolved, then you carry that pattern of contraction ongoing.
mm,
And the way in which you respond to the environment is now always going through that early filter of, is this dangerous? Does this remind me of that?
mm.
Whatever that was.
That's
This
very
seems like
interesting that there
that.
was that link. Yeah, or that there is that link to
And
the
if it's an early enough and a more significant enough event, then it really does become a filter that influences your whole physical, emotional, spiritual experience.
mm, yeah,
So that's why, there's a psychological component to this that I was very sensitive to because of my training in body-centered psychotherapy.
yeah,
And then added these technologies then become ways of addressing those early developmental trauma events in a way that's more direct and more effective.
yeah, 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 yeah. It's very interesting. The whole area is very interesting. And that link between childhood trauma and then being more prone to develop issues in later life. That I just imagine the
And
brain and the response it's doing and then carrying that for the whole because the whole Alzheimer's and dementia, I was really interested too to learn that your brain will shrink and it will, it's just whereas a healthy brain is a plump brain, isn't it? It's like whereas a dying brain is getting smaller and contracting.
yeah, and it really is that pattern. I mean,
Mm.
I really think about it from the pattern of expansion and contraction at every level of observation that
Yeah,
we can have,
yeah.
right? From physical tension, emotional constriction,
Mm.
spiritual constriction, mental cognitive inflexibility. It's the same product pattern over and over and over again.
Yeah, yeah.
So it's the same process being manifest at different levels in your system. And
Yeah.
there's a word for that. It's called isomorphic.
I've heard that word before.
That's the cocktail party word.
Yeah, right. I have heard that word before.
And it means that you're a principle that's isomorphic means that you can observe that principle operating at every level of analysis in the system, from the
Yeah,
micro to the macro.
yeah, 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 yeah. And so the light can help. How is the light then helping your whole system in simple terms then?
Well, try living without it. So you can go to the neuromatrix.health and
Yep,
order the neuromatrix device,
yep.
um, or they can order it through you.
Yeah, I'll pop a link down in the description beneath this video. Yep, yep. So when you
They
say
can
the
order
initial consultation, what does that mean? Does that mean consult with,
that. Yeah, they would. Somebody would do the initial consult. They would fill out the intake form.
yep,
They would fill out an informed consent for using the device. They would also fill out a release of information so that I can interact with their other treating people if they have any.
yep,
And then we would get together and go through all of that, right? Look at goals, look at expectations, look at their history, and then come up with a plan,
yep.
a more comprehensive plan about how are we going to help you get where you want to go.
And where do they get the EEG from?
Uh, Depending, I mean, it would be someone near them.
Okay, yeah,
So
yeah,
if it's anywhere, New South Wales, if it's Australia, if it's Brisbane, there are plenty of people all over Australia and New Zealand, plenty of people who can do the recording. And
oh,
it's about $250 or so,
yeah,
unless it's covered by, insurance, but it's about $250 or thereabouts. And then they send me the data, I do the analysis, and then we go over the analysis in the initial consultation.
yeah,
It's all combined. And then we set up the protocol for them to do the training. And then they'll check back with me in ongoing consultation. And we do that a couple of times a month to begin with, and then less so over time, because people are going to learn. I mean, my goal is to teach people how to do this
yeah,
so
yeah,
they can do it for themselves. I'm
yeah.
trying to work myself out of a job. That's what we're supposed to be doing here.
Yeah,
Right. So I'm looking to educate people how to do this for themselves more and more. And they can use the QEEG
yeah.
as a way to track improvement. So again, it's tracking using the data, showing improvement over time.
Oh, so you can then go and get a repeat EEG
Usually I ask people to consider doing 4 a year
for a year. Yep, that's
and
makes
then
sense.
and see how they're doing over the course of a year. And then they can do once a year, twice a year, depending on what they're dealing with,
Yep,
right? And if they're just biohacking, then you know they don't need it.
yeah.
They'll feel the way they want to feel, or they won't,
Mm, yeah.
and they'll
Well,
deal with it.
well, once you've got the device, you've got it always, don't you? Obviously, like it's yours forever.
Yeah, and
And
it's going to outlive you.
yeah,
I mean,
yeah. So if you're, say, if you want to use the device, I guess you get the initial consultations and you get the EEG, but then you live
Right.
with hubby or you live with your girlfriend and they just want to use it and they just ad hoc use it, put it on their head and they just use it. They're still going to get general benefits, aren't they? Like
Oh, absolutely. And the
yeah.
other thing is that because we can because we can set up protocols. One of the things I liked about the neuromatrix is that we went from two preset protocols to four.
Mhm.
So pretty much everybody in the family can have their own protocol.
Ah, right. Okay. Yeah,
So
I
you see what
get.
I mean? And that becomes really helpful down the road,
Mhm.
um, because we can program anybody's protocol to whatever they need it to be. Here, we've got preset protocols, right? And that's just what people, these are just the basic protocols that people sometimes want to use. The biohackers, they want to use something like this,
Yep. Okay. Yep.
okay? The
So even
rejuvenate
without,
programs,
yeah, even without clinical consultation, you could choose for yourself.
exactly,
Yeah.
exactly.
Yeah.
And then this is where we've got one, two, three, four programs that people can use.
Yeah.
They can set up individually,
Mhm.
and each protocol has its own setup.
Yeah. How long do you recommend using? Because at the moment, just for my own biohacking, I'm using for 20 minutes every day. Is that too much, too little? What do you think?
You know you best.
Yeah.
And what you can always do is set it for 18 minutes and then set it for 22 minutes. Is there any difference?
Yeah.
If there's no difference, then see what 16 minutes is like.
I'm more
Because
thinking whether it's the 10 minute because the one I'm using has the 10-minute cycles. So that's why I just do the 20 minutes because I do the 10-minute cycle twice. So
that's right.
and I'm one of these people that I'm very interested in brain health because when you're saying you get into a rut, I'm a little bit of a routine freak.
Right. And some people really like that.
I do,
This is
but I'm
this is
not sure. I'm not sure if that's the best though for brain expansion. Because if you're stuck in this sort of same routine, isn't that then shrinking your
exactly,
brain?
exactly. So if what you want to do is increase your flexibility,
Yeah,
then I would recommend getting the QEEG.
yeah.
I think Suvi, if I may, how about you go get a QEEG, send me the data, and we'll do another one of these where we actually look at you
That would be fascinating. That would be
and,
very
and
interesting.
program your device
Yeah,
in support of your goal of having greater energy and flexibility, and then do the protocol, and then we'll get back together and see where did you end up.
that would be very fascinating. I will.
I'm happy to do it. I think that's a
Well,
great idea.
I do too. That is a fantastic idea. Well, as
Okay.
you know, I do have an almost 3-year-old boy who takes a lot of time, but and I do have a few health things that I'm ticking off, including I've got to get my malocclusion fixed as well. So I'm in a bit of a dental journey right now. So there is a
Okay.
few things, but I will put it on. I'll find out where I can get it done because I'm here on the Gold Coast. And you think there would
Oh,
be,
absolutely.
okay,
Absolutely.
yep,
And it's only going to take you 45 minutes.
it's on my to-do list. I
It'll
just
take
put
you
it on my
45
to-do list
minutes,
today.
45 minutes to do the whole procedure. Yeah, it's
Okay.
a very quick thing. Can you see the screen?
Yes, I
The
can. Yep, yep. So the four
so this
quadrants,
is
yep,
this is the way we're programming the four quadrants now.
yep,
So each step, there are 9 steps instead
mhm,
of just 4. So
yep,
we can be much more specific about how we program the protocol,
yep.
right? And so we can use the frequency at each of the quadrants, and we can set the amount of time for each step right here in the brain.
Fascinating.
Okay. And we
That's
can do
it.
that for step 1 through 9.
Yeah. Yeah. Look,
Okay.
I'm fascinated. I really am fascinated in brain health, and it has not been a mean feat to like go through all those, years of IVF and also now to, because I've had a few birthdays. Don't tell anyone how many.
It's,
So
yeah.
yeah, so I'm very motivated in the longevity field now as well because I really want to be around to enjoy grandchildren, you know. Yeah.
Yeah. And I'm getting ready to enjoy my first great grandchild in November.
Yeah, that's beautiful. That's really beautiful. And I,
Oh,
I
it
think a
is. It
lot,
is.
yeah, and I think a lot of people are really I really am into health, wellness, longevity, and also enjoying life as you go. I think that's really important too.
Absolutely.
Having the capacity to enjoy those moments that are special. So, well, great.
Absolutely.
Well, great idea. I will put getting an EEG on my to-do list.
And
Consider it added.
we'll reconvene.
How fascinating. Thank you for your time tonight. Like I know it's late for you. And the more people we can inform about this therapy, I think the better. Because
Well, that's why I wanted to do this so that
yeah,
we can
yeah,
create something that's
yeah.
very affordable because I think I said this the last time. If we take everybody with dementia, Parkinson's, and traumatic brain injury,
Mm,
that's 150 million people worldwide. If we add to that the 10 to 27% of everyone who's gotten COVID, regardless of severity,
mm.
that's how many people are going to develop some degree of neurological injury. That's 200 million more people. So that's 350 million people worldwide who need what we're talking about today. That number's only going up. So we better do something about it now.
Well, let's hope that this interview can do a small part in trying to inform more people. And we will stay in touch. And I very much appreciate your time tonight. And thank you
It's
for your
great.
wisdom and all the information. And we'll definitely reconvene.
Okay.
Thank you.
Bye.